The topic is management of care. So management of care encompasses a lot of functions of the nurse. It's more of a general term. To look at it specifically, you can say it's the coordination of tasks to complete a goal. Let's discuss some specific examples. One of the most pivotal functions of the nurse is planning strategies to address client problems. You can think of this like care planning. We're going to have many strategies that complement one another, like medications, different therapies, and diet changes. And together we use these strategies to address client problems. Another key function is organizing resources to achieve desired outcomes. You can think of this a lot of the times as our human resources. The nurses make team assignments. We have to decide how many nurses do we have, enough to take care of our patients today? Should we ask for more? Is the charge nurse available for the whole team, or do they have to take their own patients? The nurse also acts as the liaison between clients and other healthcare team members. I always think of myself as the client's navigator. I'm the one making decisions about who sees the patient and where they're going next. Next is evaluating the outcomes of interventions and processes. This is a constant, ongoing component of nursing care that underlies everything we do. It's also part of the nursing process, and it's also part of the clinical judgment measurement model that they use to develop next generation NCLEX. So evaluating outcomes is essential. Lastly, nurses also manage conflict between clients and healthcare staff. There are always going to be situations where patients or family members become disgruntled, or there might be another type of conflict. The wait time was longer than they anticipated, or we're only human, maybe somebody made a mistake. We do our best in these situations to find a resolution. Next, let's talk through some big picture nurse management competencies. First up, we have effective communication. This is essential to nursing care. We're communicating with our patients, with their family members, with other healthcare team members, and we know that ineffective communication can really cause conflicts in all of these areas. And this is also referring to effective documentation. We as the nurses, we're only present for our shift, and we really want to have as smooth as possible a transition between our caregivers for this patient. It's really frustrating if the patient has to answer the same questions over and over again. Next up, we have business skills. These are most prevalent for individuals in those leadership and management roles on the team. They have to be knowledgeable about maintaining the finances for the unit, human resources like hiring new staff, and then also using information technology effectively. But really, this trickles down to other nurses as well, and you really need to take any opportunities you can to gain experience in these areas because you may be on the leadership team in the future. And these skills can also apply in your day-to-day role. For example, being a good steward of supplies can really affect the finances of the unit. If you just need sterile gloves, there's no reason to open a sterile dressing change kit. You can get that supply separately, so let's not be wasteful. Next up is relationship building. This can mean with your patients, family members, or other team members. Having good rapport in these areas really helps to smooth patient care. Also leadership, and this is not only referring to nurses working in management positions. We all have the opportunity to provide leadership to others by just practicing in a way that inspires and motivates others. Lastly, professionalism. This includes maintaining a positive attitude and also respecting boundaries with patients and your coworkers. And also accountability. This means taking ownership for your actions and your ability to encourage change through them. So we can tell by now that collaboration with others is hugely important in management of care. Let's go ahead and talk through some specific individuals that you'll interact with while you're collaborating on the healthcare team. It really helps to understand how each person's role contributes. First up, the healthcare provider. This refers to medical doctors, also called physicians of all types, also nurse practitioners or NPs, and then also our physician assistants or PAs. These individuals diagnose and treat medical conditions, and the scope of each individual is going to vary by region and facility. You will approach these healthcare providers to clarify and also request orders and prescriptions for your client. When you're having these communications, remember to use that SBAR method, especially when you're first getting comfortable with this type of communication. Next up is the pharmacist. They formulate and dispense medications. They are absolutely essential to providing patient care with medications. They're very knowledgeable. Never hesitate to ask questions to your pharmacist. Some of the most common times you'll need them is clarifying the administration method for a medication, or maybe the compatibility between medications. Sometimes a very sick client may have 4 medications scheduled at the same time. We've got one central line. The pharmacist can help us decide what can be administered safely through the same line. Next up is unlicensed assistive personnel. These individuals are trained by facilities and they don't have a license. They generally perform activities of daily living, such as brushing your teeth or assisting with baths. They help with changing clothes or maybe ambulating to the bathroom. Having good rapport with these individuals is so helpful for collaborating with patient care. There's a lot more information about this in our delegation video. Next up is the social worker. They participate a lot in discharge planning, including helping to prepare what supplies the patient will need and how to achieve that with their financial resources. A lot of it is finding placement for a facility to go after discharge, or maybe coordinating the delivery of medical equipment like home oxygen, or maybe a specialized hospital bed in the home. They also have current knowledge of community resources, which is really valuable for patients with limited finances. Then we have the occupational therapist. They focus on development of fine motor skills and also activities of daily living. For example, a patient who's had a stroke may need to relearn how to use a fork or hold a book. Next up is a physical therapist. They focus on the more broad motor skills, such as the ability to transfer, how to walk, maybe to use assisted devices like walkers or canes. Then we have the respiratory therapist. Their job is to help us manage conditions of the respiratory tract. What they actually do depends on the facility and a specific unit. A lot of times they'll give breathing treatments or do airway suctioning. Next up, we have the speech therapist. These individuals often work with younger populations for speech dysfunctions, but also they help with swallowing dysfunctions. So you'll see these individuals a lot doing bedside swallow tests. This helps to determine whether or not the patient needs thickened liquids or maybe they need a pureed diet. They evaluate their ability to swallow while minimizing aspiration risk. Next up, we have the dietitian and nutritionist. These individuals are especially valuable for teaching clients with chronic illnesses such as diabetes. They can teach healthy food choices and also how to count carbohydrates. Next, we have the chaplain. Chaplains handle spiritual support, whether it's religious or non-religious. Let's talk next about the role of the nurses. There are some distinctions depending on the type of nurse. There's registered nurses and then there's licensed practical nurses called PN or LPN. Some regions you'll hear LVN for licensed vocational nurse. There's a lot of overlap in the nurse's scope of practice as we're all providing nursing care, but the RN has a more broad scope of practice, so collaborating and communicating between these nurses is essential. The first piece of this is to manage client care. You may also hear that phrase coordinate care for PNs. Also, we're going to focus on performing tasks within our scope of practice, also recognizing ethical dilemmas. We receive, verify, and implement provider orders, maintain client confidentiality and privacy, verify client education and consent for procedures. And client education here is distinguished as providing teaching by the RN and reinforcing teaching by the PN. We also participate in quality improvement projects and processes, identify the need for referrals. For example, our patient may need a swallow test, so we'll refer to speech therapy. We also organize our workload to manage time efficiently, and then practice and advocate for cost-effective care. Now let's talk about conflict. Conflict can be said as friction due to differences in beliefs, priorities, or decisions. When we look at the nursing team, common causes of conflict include poor communication or unclear expectations, especially this comes up with delegation. Also, operational or staffing changes. Sometimes we can get really frustrated if our patient ratios changed to where our nurses are taking care of more patients than before. Also, opposing temperaments or attitudes. And then also poorly defined organizational structure. If we're not sure who's in charge, it can make it really difficult to function day to day. And then lastly, individual or group conflicts due to differences in interest. Let's discuss types of conflict. First up, we have intrapersonal conflict. Intrapersonal conflict means within ourselves. It's our internal conflicts that sometimes can be hard to recognize. For example, a nurse may be struggling because they want to provide the best care possible for their patient, but the patient maybe sustains an injury while harming someone, or maybe they disagree with their beliefs. And when you're with the patient, it's causing this conflict inside yourself. Next up is interpersonal conflict. Interpersonal conflict means between you and somebody else. It's between separate people. We're all familiar with this. Sometimes you have a coworker that you just can't get along with, or there's a person you have to call on the phone and they always speak rudely to you. It's when two people can't get along. Lastly, we have intergroup conflict. You can kind of think of this as like fans of sports teams. We're never going to agree that their sports team is better than our sports team. We have to be careful and avoid engaging in these behaviors. It's very demoralizing for the team, and in worst case, it can progress to bullying. Next up, let's talk about conflict resolution. Our first strategy here is avoiding. This is a common strategy, but it's not the most effective way to handle conflict. In this time, all involved parties ignore the conflict. Maybe they're not sure how to handle it, or they don't think they can do so politely. So then the resolution is postponed. Sometimes this is appropriate if you need a neutral third party or you really need management to be involved, but either way, it's not as effective because we're waiting. Next up, we have the smoothing strategy. This one focuses on shared goals. We want to focus on our things that we agree on and minimize differences. For example, we're sharing the glucometer, and that's hard, but we can say we both want to check our client's blood glucose on time, and we both want to give great care. So let's talk about how we can compromise and share. Next up is the accommodating strategy. In this strategy, we put the needs of others before our needs. So for example, we may have a situation where we go to a patient's room to give a medication, but then the lab technician walks in, they need to draw blood, or the patient care technician walks in, they need to check vital signs. Both of these people have to see a dozen more patients next. It might make the most sense for the nurse to say, hey, you guys go ahead. I'm gonna do some charting and then I'll give my medications. Next up, we have the competing strategy, when you put your needs and your goals above the needs and goals of others. This makes sense when you know how important it is that your concerns be prioritized. For example, you may be calling a healthcare provider at 2 in the morning and they may be grumpy about being woken up in the middle of the night. But that doesn't matter. We have to take care of our patient and prioritize their needs. Next up, we have the compromise strategy. This is one of the better ones. All parties sacrifice certain aspects of their goal to achieve something together. For example, you have 6 nurses who need to take a medication out of the dispensing machine at the same time. We all work together and line up as a team to achieve our goal. We're all sacrificing a little bit of time, but we're working together. Lastly, we have the collaborating strategy. This is the most ideal method. You are assertive and share your needs. They share their needs. You cooperate together, and all of you decide on a common goal and a way to achieve it.